Ladies and gentlemen, welcome to MedSynapse Specialist Podcast Series. In honor of Pink October Breast Cancer Awareness Month, we have an essential topic to cover today: breast cancer and all you need to know about it. Joining us is the esteemed Dr. Basema, consultant obstetrician and gynecologist at Emirates Specialty Hospital in Dubai. Dr. Basema is deeply committed to delivering a high standard of care to all her patients. With extensive clinical experience in general obstetrics, gynecology, cosmetic gynecology, and gynecological oncology, she is the perfect expert to answer your questions about breast cancer. Welcome, doctor.
Welcome. Thank you for this honor. Thank you.
Thank you so much for joining us in raising awareness on breast cancer. Now, let's begin with our podcast today.
Yes, let us start.
Dr. Basema, to begin with, what is the importance of Breast Cancer Awareness Month and how has it evolved over the years?
Yes, this is important to know that breast cancer is a very common disease. In United States, there is one woman between 8 women will get breast cancer in any stage of her life. And in UK also, we have one woman from 12 women. So this disease is very common and it's a threatened life disease. And if we can detect it early by awareness, how we can detect it early, we can survive a lot of women. If we detected breast cancer early, we can survive 90% of female. That's why they start from 1990 to make 1 week in October as awareness for all female how they can detect breast cancer early. And then what WHO start from 2007 to consider October pink to making campaigning to make every woman know how to knowledge her breast, normally breast, and how to behavior when she feel that any abnormal mass, any abnormal thickness in the skin, and what is test she can do to give her good chance for early detection of breast cancer. So this is important, and for this global disease, this threatened life disease, we have to go and start fighting this battle to victor. And a lot of female could fighting and winner and survival not only woman, survival all family, because mother is very important to her family.
Definitely, Dr. Basema. Our mothers are the the root
essential
of
membrane in our family. Yes.
Exactly. Now, moving on to our next question. Could you please explain the basics of breast cancer, such as the risk factors, early detection methods, and common symptoms?
First, we know that cancer is uncontrolled growth for cells. These cells will be not healthy cells, and it starts in any side of body and then go to other side of the body. Usually, there is some. For us, we don't know why breast cancer happened. All cancer, we don't know why it happened. We know that cancer is uncontrolled growth, increase in number of cells, which is bad cells. It causes problem for breast, and it is also stimulation to other part of the body. But there is some risk factors. Some risk factor we couldn't change, like if we are female, it is risk factor to get breast cancer. If we get menarche early, because that means we get more estrogen, which is like essential for getting يعني estrogen, increase in estrogen in the body. That means you are more candidate to get breast cancer. And also if we late to get menopause, يعني when we get estrogen more in menopause, يعني late menopause, also it is candidate to get breast cancer. Also some genetic, يعني when we have one relationship, first relationship like mother, sister, and that is mean we have more risk factor to get breast cancer, but it is only 5%. يعني not all breast cancer means it is genetic. But some risk factor we can control, like if we are in stress. Stress cause breast cancer. We saw a lot of female which they suffering from stress. They are more candidate to get breast cancer. Also obese. You know why? Because in fat tissue there is also more estrogen. There is transfer hormone to estrogen. If you are not doing exercise, if you are smoking, alcohol, if you are get your baby, first baby when you are more than 35 years, all this not good diet, يعني not healthy diet. Also not only breast cancer, يعني if we are not live good healthy life, we are candidate to get cancer more than other. So if some control risk factor, we can control, like we have to not smoking, not taking alcohol, we have to be doing a lot of exercise, we have to get good weight, not too much obese. Obese is very dangerous to get a lot of disease, not only cancer, also cardiac disease and stroke and a lot of disease. So sometimes we can control, but sometimes we couldn't control. Anyway, I think the only way to control on breast cancer is to know how to get all information about early detection. Self-exam, ultrasound, mammogram, MRI, all these things we have to know when we do this test and how to do it.
Now, moving on to our next question. How often should women perform breast self-exams, and what should they be looking for during this self-examination?
Yes. First things, from 20 years, every female must know how to do self-exam. Why? Because our aim is to make all female knowing normal breast. That's why we can discover abnormal if we know normal. This is our aim. Second, for reproductive age, we can do this exam only in the 8th day of period. Why? Because in this time the hormone will be less, so there is no abnormal change in the tissue of the breast. So this is the breast. You can every female must do this test. She can fix this part of the breast and start from this corner, and we can fix breast from down, fix it and try from this corner part by part, you see, to see if there is anything abnormal. See, in the 8th day of period. Okay, actually a breast is contain 3 parts, here nipple and here also, and armpit also. So after we finish from upper part, we have to fix upper part and go to same corner and start in this way. You see if there is anything up. We have to use this part of our hand. we have to screen all breast, and then we can put our hand on upper our head and see if we have any abnormal mass in the armpit. Same in other breast. And second part of this exam, it will be in your bedroom. You have to put pillow under shoulder, and this time one hand over head, other hand. This time we have to start in circle way. We have to start from nipple to get all breast, and also we have to search if we have anything abnormal in armpit. This is important things because 90% of breast cancer discovered in this simple way. Anything abnormal. Sometimes we have, not all mass means we have cancer. Some masses considered as fibroadenoma, some cyst. We have a lot of things benign, but we have to check that it is benign. What about if a patient is post-menopause? Of course, all of us know aging is a very important risk factor to get breast cancer. So with increased age, this is more increased risk factor to get breast cancer. So in post-menopause, always I said to female, when you get your salary, please try to do this exam in fixed day of the month. So second things, we have to do some imaging, which is very good development and give a very big chance for survival. It's mammograph. Mammogram is X-ray, but it can discover mass before we can even get it by our hand. And if we discover early, that means we can do a small surgery. No need to remove all breast. We can remove only this mass with checking that this mass, margin of this mass is normal. So detection early, and by the way, screening for breast cancer start from age 40 and every 2 years, but after 50, because there is increased risk, we have to do every year mammogram to check that there is no any abnormal mass in the breast. But what about a lot of female now putting implant? For those, mammogram will be very hard pressure on the breast. So those female advise them to do MRI, which will not cause any pressure on the breast. So this is very good step to do. First thing, self-exam. Next step, to do mammogram. Start from 40 years, except if we have any female in the family with breast cancer, especially when breast cancer start when like mother, sister, before 50 years. That means we have risk factor. We can do a genetic test to check like some genetic problem like BRCA1, BRCA2. It make us more awareness to do our best to avoid to get breast cancer.
Thank you so much, Dr. Basema, for the visual explanation and for making the steps look very easy for our audience. Now, moving on to our next question. As you have mentioned about the genetics, let's go a little bit deeper into it. Like, what role does genetics play in breast cancer, and when should someone consider genetic testing?
Yes, actually, as I told before, genetic breast cancer is not more 5%. And For some family, if we have more than one membrane with genetic breast cancer, we can do some tests, some genetic tests to check. Yani all of us know that Angela Jolie know that she had risk factor and she did surgery, and of course now implant. يعني sometimes implant is more beautiful than real breast يعني to avoid cancer. So really some families, if we have more than one membrane, and especially if breast cancer happened in young female less than 50 years, those must يعني like focus on them, and we can do genetic test, and we have to teach them from early years how to do breast self breast test, and from 35 we have to do mammogram for them to take one photo. It is يعني like we can go back to it when we need to see what will happen after. So genetic breast cancer is happen, but not too much. A lot of cases, يعني 95% of breast cancer happened without anything before, any risk factor. So if we want to survival from this life-threatening disease, we have to go to early detection. This is only one way to protect ourselves from this bad disease.
Now, moving on to our next question. Could you please discuss the various treatment options available for breast cancer and how they have improved over time?
Okay. Of course, after we discover that we have mass, we have to check from this mass, this tissue, what the kind of cancer. And we have to get biopsy, and from this biopsy we know the kind of cancer, because we have everybody know that we have ductal and we have loop, and usually 80% of cancer happened in ductal of the milk in the breast. Usually we have to check even from receptor of hormone in this biopsy. يعني from biopsy we can decide what we shall doing in next step. Of course, surgery is the first step, and we can do chemotherapy, radiology, and we can give some hormone like tamoxifen. Sometimes before we give tamoxifen, which is anti-estrogen in breast, we give to 5 years, but sometimes nowadays, maybe more than 5 years, we give this tamoxifen, which is anti-estrogen in breast, to prevent any recurrent for breast cancer. But by the way, tamoxifen double acting. يعني on the uterus, it will be cause maybe cancer in the uterus. In the same time, it is prevent cancer, breast cancer to recurrent on the breast. So we give this medicine. We have to check from thickness of the uterus. We have to check that there is no hyperplasia, no cancer, no bleeding. We have to control on uterus. This is important. So every kind of cancer needs some, every stage also needs some kind of treatment. But usually we compound like surgical, chemotherapy, radiation, and even hormone, and even now they start to use even immunization treatment also. So all these things, يعني of course, يعني we deal with this issue individual according to woman, age, everything.
Now, moving on to our final question of the day. How does pregnancy and breastfeeding relate to breast cancer risk and diagnosis?
Oh my God, this is a very difficult part of breast cancer. Usually survival with pregnancy with breast cancer is very dangerous. You know why? Because there is a lot of hormone in that time, and it is difficult to detection because there is a lot of change in breast during pregnancy. And we don't consider only during pregnancy breast cancer, even if cancer happened after 1 year of delivery. So it will be difficult, but we can do surgical in any time, any stage, any trimester. But for chemotherapy or radiation, we can postpone it to the second trimester. By the way, we can give even radiation, 5 rad. It's safe for fetus, and we can give even chemotherapy from the second trimester. Of course, we need some specialist team to deal with these cases. And there is a very, very aggressive kind of breast cancer. It's inflammatory cancer. It happened like, and you think that it is abscess, it's inflammation. And actually, I lost one of my best friend. She were only in breast feeding for her baby and discovered that she had this very bad kind of cancer, and it was very difficult to control, very difficult to diagnose. But any inflammation, any infection, if late more than 1 week, we couldn't control, we have to get biopsy to check what is going on. So pregnancy is very bad time to get breast cancer during it. As I told you, survival rate, it's only 10%, my dear.
Thank you so much, Dr. Basema, for delivering this informative and insightful podcast on breast cancer awareness. Your expertise and dedication to spreading awareness are truly commendable. Thank you so much for joining us today.
Thank you for giving me this big chance. Thank you very much, my dear. You're
Thank you so much, and looking forward to many more podcasts together.
Next podcast.
And to all our wonderful audience, we greatly appreciate your time and interest in our content. Remember to hit the like button and subscribe to MedSynapse so you can stay updated on the latest updates in healthcare. Until next time, thank you so much for your support and engagement. Goodbye.